Good afternoon, everyone, and welcome to today's webinar, Telehealth, introducing video visits with your patients. Thank you all so much for giving up your time today to listen to this exciting and informative event. My name is Sally, and I'm from Eastern Melbourne Primary Health Network. Our guest speakers today are Jude Cobb and Jodie Earle, both from Health Direct. We also have Dr. Arthur Zulman speaking from the point of view of a GP. Eastern Melbourne Primary Health Network is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. Before we begin, just to let you know that you are all on mute, the session is being recorded, and I will be sending out a copy of the recording and the slides after the event. And if you've got any questions, please put them in the Q&A chat box at the bottom, and they'll be answered at the end of the presentation. I know a lot of you did put questions in when you registered, and they'll be answered at the end of the webinar as well. So today's webinar, we will be discussing several learning outcomes: an overview of Health Direct Video Call and its benefits, how to create an account, a demo of the platform, and integrating video call into GP practice workflow. So I would now like to read the Acknowledgement of Country. We would like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea, and community. We pay our respects to them and their cultures, and to elders, both past, present, and emerging. Now I would like to firstly hand over and welcome to Jodie Earle from Health Direct.
Thanks. Hi, I'm Jodie. I'm the Customer Support Officer for Health Direct Video Call. Thanks for joining, everybody. We'll do a little bit of an overview of telehealth in general today. If we can have the agenda slide, that would be great. We'll talk about telehealth, video and phone, and then we'll go through a little bit about our platform. Jude and I will do a demo, and then Dr. Zulman will also do a presentation on how he uses our platform in his practice. And then definitely questions at the end, and we encourage questions from everyone. Thanks. Okay, so why telehealth? I think a lot of you would have been doing some form of telehealth, particularly during COVID-19. It's a very, very good solution for providing continuing care for rural and remote patients and less mobile patients, whether or not there's lockdown. So this graphic gives a really quick snapshot of the activity of telehealth in June 2021 in Australia. So there was, as you can see, a huge number of telehealth consultations done, over 3.5 million. 93% of those were by telephone and 7% on video, which might seem small, but that has risen from what would normally be about 3% in video. So I think definitely a good figure. And if you have a look down at the bottom, the total number of telehealth consultations since the onset of COVID has been 62 million. So it's huge numbers, and a lot of practitioners are finding that telehealth, whether video or phone, has been amazing in helping them continue care during this period. Thanks. And why would we be using telehealth? The number one thing would be convenience, I would say. So telehealth allows you and your patients to have a consultation wherever you are. Holidays for some of us at the moment seem like a little bit of a wish. But whether you're in Australia or overseas, whether you're on holidays or your patient's on holidays, you can still have a telehealth consultation to continue their care. Also, telehealth saves a lot of time and money. We have a savings calculator on our site, which looks something like this little picture here. I've put in just if one GP was doing 2 or 3 consultations a week, the calculated savings for their patients over a year would be $30,000 in travel, so petrol, fares, 94 trees saved. There's fuel savings there. And if you then add in what the savings would be for the clinician as well, and you've got a couple of GPs in your practice or clinicians in your practice, the savings do really, really mount up. So convenience and savings are two of the main reasons why telehealth should be here to stay. Thanks. A lot of you would be doing telephone, and a lot of practitioners are, and it works really, really well. Everybody has a phone, phone's easy and phone's convenient, but video is becoming more and more important in telehealth. And I'll give you a couple of reasons why video might be more suitable than phones. You do have a greater level of engagement with your patients or clients in a video consultation. It's definitely more suitable for longer consultations. So healthcare plans, and you can in a video have aspects of a physical examination, whether that's for follow-up appointments or if you need to see something with your patient. For chronic care patients who may have their own devices at home for blood sugars or blood pressure, you can share those things in a video call as well. So where you may have needed those patients to come in for a face-to-face, you can do that on video. Particularly with chronic care patients, and we're hearing with mental health as well, it's easy and comfortable access for their GPs. And studies are showing now that chronic care and mental health in particular, the patients that are having videos are having a much lower cancellation or no-show rate. And for chronic care patients, it's showing that if they're doing telehealth consultations, there's a lot less hospitalizations in that group of patients. With video, you can easily add additional participants in. So whether that's a specialist, an interpreter, a family member, they can all join into a group video call, which would save your patient from coming to see you, going to see a specialist, coming back to see you. You can get all of those things done in one. Both patients and clinicians can share resources during a video call as well, which you wouldn't be able to do with a phone call. So the patient can share their referrals with you, you can share information or referrals with them, or any other sort of resources that you might be providing normally. The other thing I think worth noting is that telehealth MBS items do seem to be moving to encourage video. So if you can start using it, then there's a financial benefit there, certainly for you. Thanks.
Thanks, Jody. So I'm just going to go through Health Direct video call in particular, and then we're going to do a really quick demonstration to kind of just show you how it works. So Health Direct video call, purpose-built for video health consultations. So that was developed and in operation since 2014. So we have been going for 7 years, and initially developed for our telehealth helplines like After Hours GP and Pregnancy, Birth and Baby and things like that for Health Direct, but also for primary and tertiary care. So because it's purpose-built for health consultations, it's got health grade quality, security and privacy built in. I'll talk about that in a moment. So the flexibility on a national scale, as you can imagine, March 2020, a lot of telehealth has happened since then with the pandemic. So we've been able to grow with our model with the onset of COVID from around 500 video calls per month, scaling up to really quickly 25 to 30,000 video calls per month. So you can see that that is a huge growth, and the way that our platform is designed really allowed that growth to happen very quickly and securely. Currently, just to let you know, in July 2021, 350 GP practices were onboarded and trained with video call, and we're currently seeing that trend. We're onboarding a lot of primary health services at the moment. Over 30% of Australian GP practices have a video call account currently. So just to show you the scale, we've got 60,000 users, over 60,000 users using video call in 8,500 clinics across primary and tertiary care. And we provide support for all of those people as well. financial year 2021, so just in about July, we reached 1 million health consultations on the platform. So there's a lot of video telehealth going on in Health Direct Video Call. I'll just go into the benefits just really quickly. We use a virtual waiting area model. So just like a health service would have a physical clinic, because we're purpose built, we've decided to go through and it mimics the way that your clinic would work with a waiting area. So we've got a virtual waiting area dashboard. When you sign in, when you've got an account, you'll see your patients waiting in the waiting room and you can join them just as you would in a physical clinic. There's no special equipment or software downloads required. So video call works browser to browser. So if I'm in the Chrome browser and how I get onto the internet and I have a video call with someone else, they can be using one of our supported browsers, and there's no software in between. So as I said, we need an account if we're a service provider, but patients don't need an account. So this is really important. They simply click on a link. Every clinic has its own link. Send that to your patients. They click on that, put in their name and phone number, and they arrive in the clinic waiting area. So they don't need to know any contact details or meeting IDs or anything like that. Privacy and security built throughout the platform. I mentioned it's browser to browser, and all of the video and audio stream that you're doing when you're in a video call are fully encrypted connections. So nobody who's not authorized to be in the call can read any of that information. Also, while the call is in progress, our web servers are all in Australia, so data sovereignty is really important as well. Everything is in Australia, and our company is obviously Australian as well. After the call is finished, no patient identifying information or personal health information is stored. So if your patient shares something, who Jody was saying, if they share something with you during the call, you need to either download that or take a note of that in the patient record before the call ends, because everything is then purged. So very, very secure. And we are government funded, so free to use for eligible health services and their patients. Currently, GP usage is free until the end of December, and other primary health, sorry, I'm just moving something out of the way here, other primary health services until June 2022. So the government usually funds in blocks, and that's when these funding blocks are finishing for this round. Then the MBS items are reviewed and the funding as well. So we do have a lot of services, as I've mentioned, using our platform, and there is a lot of video telehealth going on in Australia. So the anticipation is that that funding will continue. And we let our users know as that happens. So just a quick visual. So in terms of the patients not needing an account, on the left here you can see a picture of a smartphone where the patient has been sent their appointment information and been told 5 minutes before their appointment, just click on the link. You can see the link there, that's an example clinic link, where they can put in their details and arrive in the clinic waiting area. So it's really simple to do for patients. We have patients from all demographics and age groups who use video call and find this a very simple way to get into the clinic waiting area. If anyone does have any issues, our phone number comes up for them, and we are there to support patients as well as service providers, just so that you know that, that are using video call. On the right-hand side, you can see an image of a tablet, and that is our sign-in screen. So for service providers, you'll get your account. We'll talk about that a little bit later on. You put in your email address that you've been invited with to the platform, your password that you've created, and then you arrive in your clinic waiting area. So you can use any device. You can use a smartphone, a tablet, a computer. As long as you've got a microphone and a camera and an internet connection, then you'll be able to do a video call. Just quickly on the administration side of things, when you're a team member, so you're a doctor or a service provider, you haven't got clinic administration rights, but every clinic would have an administrator, and that allows your clinic configuration to be set up, allowing flexibility for your current workflows, and enables your clinic administrator to set up the clinic to suit your needs. So what that means is our system is really flexible, and clinic admins can set up to meet the service needs, and we can help them to do that as well. You can set up automated messaging. You can set up your clinics as you would like them to be. You can set up your waiting area hours. There's a whole lot of things you can configure. And clinic admins have a range of quick configuration options to use as desired. Some of the things can be left very easily on the default, but there's just that option there if you'd like a little bit more configuration. The main things that you need to configure when you first set up a clinic are your team members, so that people are added and they can access the waiting area, and the waiting area hours. So when we do a quick demonstration, I'll just show where that is. And supported, so our support team can assist and support every step of the way as required. Just a quick look at that now. So what I'm going to do quickly before coming in and talking about the support is do a quick demonstration with Jody. I'm just going to I'm in the Chrome browser here. What I'm going to do is quickly stop sharing my camera. And Jody, I don't know if you've stopped showing yours as well. It looks like it, just because otherwise our camera won't work in the video call because it's currently being used in the Zoom. So once you've got an account, and you get that from your clinic administrator or your telehealth manager, we'll talk about that after we've shown here, you can access. So I'm going to go in with my email that's my account is set up with. So this is our sign-in page, vcc.healthdirect.org.au, and you can just add that as a favorite to your browser. As I said, you can use any device to come in. So I'm just going to click next, put in my password. And I'll keep myself signed in for today, which means it won't log me out if I have a little period of inactivity. So here I am in the platform. I've got more than one clinic associated with this account. So I'll come to this My Clinics page. Some people have more than one. They may have one, they may have 2 or 3 clinics associated with their account, or you may just have one. If you've got one, you'll go straight into your waiting area. If you've got more than one, you'll come here and you can select which clinic you're working in at the moment. So I'm just going to go to Acme Cardiology. So here I am. This is the waiting area dashboard. This is, I know that Dr. Zorman's also going to show some of this as well, but where we are now is the center part here shows any callers that have been sent the clinic link and have come in at the time of their appointment. So this person, Tom, is waiting to be seen by their service provider. There's a lot of functionality in video call, and I'm just going to do a really quick demonstration today. So I won't go through everything. We do have training options and a lot of information in our resource center, but just so you get a quick taste today. Down the right-hand side here, there's various things, and this is the share the link to your waiting area. So this is the link to the waiting area here. As I said before, all patients use the same link, and they are sent that link and come in and arrive as this person has. So I'm just going to send this to Jody. I can obviously, I can copy the link, and then I could paste that into reception email with a bit of text around it and send the link for the appointment. Or I could put it into a template in my practice management software that you would already be doing templates for perhaps face-to-face appointments as well. You could create a video call one. The important thing to include is the link. Or I can go in and send an email or SMS directly. And excuse me while I type this in. And then Jody's going to come in. Have I typed that correctly? Okay, so what I'm going to do is send that, and this is sending the link to Jody. It says the invite has been sent, so I'll just close that up. And then what Jody does really quickly is she clicks on that link, puts in her name and details, and she comes in. So I can see here her phone number's already been added, and I can see the patient name. So if Jody's my next patient, and that's who I'm seeing, I would join the call with her. So I'll just do that now. in this clinic, we've configured, your clinic admin can set this up, that there's a little confirmation. So if there was a lot of people waiting here and you click join call, just on the off chance that you click the wrong button, it gives you a confirmation here. Yes, I did want to join Jody, and here we are coming into a video call together, so I will join. Now we are doing this in a shared screen in Zoom, so hopefully this is going to look okay. There's Jody. Hello. I'm just going to mute myself in the call, and that's just because we're obviously talking in Zoom as well, so our microphones are doing two things. So I'm the service provider in this case, and I've just joined the call. I can see here, I'm in the smaller screen, Jody's in the bigger screen, and we can have our consultation. So I can see her and I can hear her. At its simplest, that's what you do in video call. And at the end of the call, you would hang up. But video call has a lot of other functionality, and I won't go into it all today, but I'll just show, we did mention about sharing resources. So up on the right-hand side here, there is a tools button. And if you open that up, it opens up this little side panel, and you can share a screen. You can add a whiteboard if you normally like to share diagrams or explain something to a patient that way. You can play a YouTube video. You can have a play with this if you have a video call account, or when you get one, you can have a look at these options. So if I wanted to share an image or a PDF, I'm just going to share a little picture of an X-ray today. So you would click on what you would like to share, and then it will take you into your computer and you would just navigate to what you'd like to share. So I'm going to say open, and now we can see an X-ray. So that is shared into the call. Jody can see that as well, and we can discuss. If I needed to, I could annotate over the top of that as well. If I could say, well, this is the issue here. You can add text, you can add a highlighter, so that it's really clear to Jody what I'm explaining to her about this result. And so she can see that as well. She can also annotate if she says, oh no, but I'm getting pain over here. Whatever is required, she can access that as well. You can also download. So at both ends, I'll let you know, there is a little button you can click so that your patient can't actually download this or interact with it. But currently I haven't selected that. So either of us could download this. If you press download, you can save the original document, which is the X-ray, or you can save it with the annotations over the top. They could save that so they could remember what you'd been speaking about today. Or if Jody had shared this with me, I could save that into her patient record. That'll save to wherever your downloads folder is. So if I go up here, I can see the little number 1. If I go back to tools, I could share another one. If I share a whiteboard, for example, I don't know, I'm just making something up. So basically you could share a diagram, you can do the same thing and annotate over the top. So that's just 2 examples of some of the tools, and you can see here that there's also a screen share if you want to share your screen with your patient. Just quickly, you can also get other people into a video call. So currently up to 6 works really well in video call. And that is 6 participants, and we're working on our roadmap very shortly to get more participants into a video call for group sessions and things like that. So as the host of the meeting, because I'm the service provider signed in, I've got this little call manager, and I could invite another participant in. So that was a family member, a specialist. If I do have interpreter details handy, I could invite them in, and that's a simple invite participant, put their name in. You can either send email or SMS and come through. So that's not inviting them into the waiting area as I did before, that's directly into this call. Then once I'd put their email or the SMS number and click invite, as soon as they get that invitation, they'll come straight into this call. Because I've invited them straight into this call, they don't have to wait and knock on the door or anything like that. They'll come in and we'll continue the call with 3 participants. Really quickly, what I'm going to show you now is another way to get somebody into this call is to go back to the waiting area and get them in from the waiting area. So if you've let somebody else know, and this could be your interpreter or anybody else, to come into the waiting area, you've given the link, then you can go back. When this call opens, it opens in a separate tab. I can go back and I can go between the two. So you've always got your waiting area dashboard available and your call screen opens in a separate tab. I'll just go back. You can see with my account now, because I joined this call, it says my call. And anybody else waiting in here, there could be one other or 10 other people, they'll all say add to call. And if it's appropriate, if I know that Tom is the carer, then I would add to the call, come back into this screen, and I would see the 3 of us there. So there's a couple of ways to get somebody else into a call. So once again, this is on the right-hand side, the link to get into the waiting area. But if you want to invite them straight in to the call, you'd do it via the call manager. I won't go through the other functionality at the moment. There is quite a bit more functionality that you can do. It's all obviously optional and to be used as it suits your workflow. Once you're finished with the video call, thanks, Jody, I would hang up. So there's a couple of things you can do. If I click the hang up button, you can either leave the call or you can end the call. And this is really good because if I'm in a call with just Jody, so just one other person, and I leave the call, it will put that person back on hold in the waiting area. So it's possible to do that, where they might be picked up by a receptionist or another doctor, whatever the workflow is, and they could take a payment, make another appointment, or continue on and see another doctor if that's appropriate. If you end the call, that will end for everybody. So that would end for myself and Jody. Actually, just to mention, if you're in a call with, say you'd invited somebody else in and there's 3 of you in the call and you leave, the call will continue with those people in the call until somebody ends it. So if you leave them with a specialist, for example, you may invite a specialist in, then say, thank you, I'm going to leave now. If you leave, they can continue on with their specialist. So they haven't had to go and have 2 separate appointments. They're actually seeing you both within the same video call. You leave, they continue on. So that's a couple of options with leave call. What I'll do now, though, is I'll end the call. So this will show that our session has finished, and that will say the same for Jody as well. And then if Tom was my next patient, I could come along and join the call with him as well. So that's an overview of how that works. And just really quickly before I finish up, we do have our support team. We can help get set up. We can help you with any workflows. We do have training available as well, and that's all free training. We also have videos on how to also. And our resource centre, you'll have these links after this session. So you can see what our resource centre has: articles, videos, downloadable guides and templates as well, all available for you. I've already mentioned the training, but just quickly, we do run regular familiarisation webinars. We do have RACGP accredited training as well for CPD points. And we can also work with specific organisations and teams to get people trained up. So it's really flexible and you can always contact us and we can work out the best way to do that. So the 4 steps that we're to really get started is to register for an online clinic if you don't already have one. And we've got, you can either do that through the PHN or through us using an online form. Once that's set up and the clinic administrator has added and managed the team members, can create your account and sign in. Send the clinic link to the patients as you saw me do that with Jody, and join a video call with your patients and clients. And then just on here is our contact details. So we do have an email that comes into our Jira system so that we assign that to somebody and we assist you with any queries you may have. And we've got a phone line as well, which is Monday to Friday, 8 AM to 6 PM local time. So thank you. I believe that I'm now handing over.
So Dr. Zillman is now going to have a talk. He's got a PowerPoint presentation as well that he'll bring up onto his screen and go through his presentation with you. Also, Dr. Zillman's presentation I'll be sending out to you all as well after the event, so the next couple of days. And we've got lots of questions coming in, so please keep them coming in and we'll answer them as soon as Dr. Zillman is finished. So over to you, Dr. Zillman.
Thanks, Sally. Hi, everybody, and thanks for joining us. Just to quickly, I'd just like to thank Sally, Kirsty, Bob, and Tom from the PHN for making this such an easy process. When I started out with Telehealth and with Health Direct, it was super easy just to register and take it from there. But more importantly, I'd just like to point out like Jude, Jody, and the other team at Health Direct, the support is fantastic. I mean, I've never had a problem not getting hold of someone. If they haven't answered the phone, I've sent them an email and they've always got back to me on that same day. So if ever you've got any questions, if you can't log on, if any of your patients have difficulty logging on, they need some hand holding, support at Health Direct is fantastic. So basically my aim for this talk is that I'm hoping at the end of my talk, you'll all be very comfortable using telehealth video consultations. They're easy and they're great fun. As far as I'm concerned, in my practice, when we use the word telehealth, we talk about video consultations. We're not talking about phone consultations. It's a specific, I think it's a vernacular we should change because I think telehealth should really specifically be referring to a visual video consultation. There are lots of pros. I'm going to run through a few pros and a few cons. The lots of pros is firstly, it's really easy and it's efficient. And by the time I'm finished talking today, you'll be confident that it is easy and efficient. It's actually much, much, much faster than seeing a patient face to face. Getting out of your chair, going to the waiting room, calling them in, seeing they're not in the waiting room because they're a bit COVID phobic and they're sitting in the car. So you've got to find which car they're in. It's so super quicker to use a video consultation or Health Direct than actually in reality, having them face to face. The other thing is, it's obvious that Medicare seems to be moving away from phone consultations and we can't do mental health plans. You need to do either a video or a face-to-face. For management plans and team care arrangements, my understanding is you need to either be a video consultation or face-to-face. You can't do those through the phone anymore. And also you can go for long consultations. I had a 50-minute video consultation yesterday. So it's far more in line with what we really do in reality. Personally, I found counseling much more rewarding on a video consultation than in face-to-face. I find adolescents seem to be far more comfortable in the safety and the confinement of their own space. They open up more, they're more comfortable, and they seem to enjoy the process far more. Often spouses join in. I had a patient yesterday morning he's always come by himself to the consultations. I've never seen him with his wife in the same consultation. And yesterday I was dealing with his out of control diabetes control. I was wanting to increase his Jardiance and his Jardiance. And then his wife puts her head in the door out of the blue and says, "Have you spoken to him about his diet? He's been eating a lot more bread and fruit lately." So there's a lot of things that happen during a video consultation practically that make it far more useful than having just him sitting by himself with me. You don't need a mask. You can see their face, they can see your face, you can breathe air properly. It's much better consulting without a mask. There's lots more nuances you can pick up. Also, we're all fearful of that asymptomatic patient that comes in for a blood pressure check, and then you get a health department phone call the next day or 2 days later saying, "I'm sorry, you're going to be locked up for 2 weeks at home." This is the time where you need to perfect your video consultations. I don't think we should wait until you're in lockdown at home because your patient came in who happened to be COVID positive at the time without knowing it. So my advice to you is embrace video consultations, because if, God forbid, you're in lockdown, you'll be easily able to just continue working from home, doing video consultations as if you were sitting at your surgery. Also, you can use it for other things. While I'm doing my video consultations, I'm uploading to my health record at the same time. In best practice is Shift F9. It's easy. It flows very easily, and I'll show you how to do that. Another thing is that when Jude was talking about having more than one person in the consultation, I've used it a number of times for return to work conferences, meetings with employer. But mainly, like if you look up return to work conferences on TAC and WorkCover, there's quite substantial reimbursement for that. And it's really rewarding. You don't have the OT or the physio sitting in your waiting room with the patient for half an hour while they're getting frustrated. You just send them a message when you're ready. They come in, they join, the patients there waiting for them as well, and you can have a full functional return to work conference. It works really well. The other good thing about video conferences is that at the moment when people are in lockdown, like we are in lockdown, that 12-month rule does not apply. You don't have to have seen the patient in the last 12 months. So at the moment, if you've got a patient who you haven't seen for years, my understanding is you can do a Medicare consultation as a video consultation because we're in lockdown. The cons are very, very basic. And the cons to me is, number one, sometimes I get very, very comfortable doing, and they're very long consultations. So the consultation time can blow out. And secondly, often I forget to make notes because I'm getting carried away, the patient's getting into it. So you need to be cognizant of the time and the fact that you need to make your notes after each video consultation. So what I want to achieve today is, number one, how you can get the message through to your patient, how the telehealth consultations work. Number two, how the patients can log into your virtual waiting room or just come into your virtual waiting room. And number three, how you can easily use Health Direct more effectively. And I'll give you some tricks and tips that I've managed to develop over the months. So the way my system works is that at my surgery, the receptionist, when they make an appointment, always puts it down as a telehealth, not a telephone. And the patients are well aware that this is going to be a video consultation. They're going to get a text message or an email and they just follow the prompts. That's the main thing they're told. Then I'd like to share with you my desk setup, how I set up my desk, how I set up my camera, because there's some tips there that you might want to take on board. Then I want to share with you how you invite the patients into the waiting room, so how they know how to come into your waiting room. And there are two ways that I use to message the patients about when they can actually log into the waiting room, come into the waiting room. And then I'm going to show you a few enhancements that Health Direct offers you and how I set up my computer screen. The way I set up my computer screen with every single telehealth consultation is on the left-hand side of my screen, I see myself and the patient. And the right-hand side of my screen, I have the patient's notes. So I'm making notes, I'm sending e-scripts, I'm emailing them their results, all at the same time while I'm actually looking at them on the left-hand side of my screen. It's easy to do, and I'll show you that briefly. So basically, the first thing I want to show is inviting patients, and I'll show you a quick demo of my ways of inviting patients. And the second thing I'm going to show you what the patient sees, what the patient goes through when they are trying to come into your waiting room. Okay, so the way I invite my patients into the consultation or to send them the message, there's two things you can do. And I apologize if this seems a little bit complicated initially, but it's actually really simple. If you do it once or twice, it's easy. If anybody who's listening today wants some more advice from me or wants to contact me for any questions, I'll be more than happy for you to come to me directly or to go through the support people. But I hope I'm not going to make it sound look too complicated, because it's not. So I use best practice, but I'm sure Medical Direct and all the software packages out there do the same thing. So you can send text messages directly to the patient from your software. So for example, this is a DUD patient named Jeff Practice. Now, if I want to, I'm ready for Jeff. I want him to arrive in the waiting room. It's time for his consultation. I go to my message utility in best practice, and I've got a template. You can have a number of templates, but my primary template that comes up first is my Health Direct template. And what I do is then I send him a text message within best practice, and that's been sent now. And he gets a text message immediately, and he goes into the waiting room. That's the one way you can message him. You can send a message from best practice directly. That's the only issue with that is the messages that you send in best practice need to be a bit concise and small, because otherwise they charge you more per once you go over 160 characters. So another trick that I use mainly is, and this might sound complicated, but it's not. I go to my word processor, and I've got a template at the top of my word processor I double click on, and it's just it's a template that puts their mobile phone number at the top, and then the steps, one at a time, what they have to go through. I highlight that, and I cut it. I get rid of that document, and then I go to the Health Direct platform that you see here, and you see it says send an email. or send a text message. I click on ping a text message, I paste in their phone number, and I paste in the message, and I click send message. This really takes about 10, 15 seconds. And now that message has now been sent to the patient. It's a longer message, it's clearer, there's more steps. That was a text message that just come through. Okay, so those are the way you can tell the patient time to come in to your waiting room area. I also sometimes send emails. There's a way of sending emails as well, but I won't go into that now. So what the patient sees on their phone or on their computer, whatever they're using, is this is what comes up. They click on the link in the message and it takes them to that. And they're going to follow the steps. They start the video call, and now you won't see my face there because my camera's being used for the Zoom that we're on. But I'll just put his name. His name is Jeff. Practice, and they set the terms and conditions and they click continue. Okay, continue, and then what happens is they now get this message. Okay, and the message says this is all it's been set up for my practice. This is thank you for arriving at Meston Medical Centre waiting room. Please be patient. Your doctor will be with you shortly. Please keep watching the screen. Please press the triangle below and listen to the message. And it's been interesting. I've been doing an audit, and every single one of my patients that's been coming in the last week have actually done this and listened to the message. So I'd like to. This takes about 30 seconds.
Hi, this is Dr. Zorman speaking. Well done on reaching the situation where you are now. That means you know how to use the system. Please do not touch your phone or your computer, whichever you are using for this. And please keep an eye on the screen, because there will be a message coming up soon that asks you to share your microphone and your screen, and all you need to do is click allow, and that will take you into the consultation. The doctor may be busy with a patient at the moment, and that's why there's sometimes quite a bit of a wait. It could be 5, even 10 minutes, but we know that you are there. So please just wait, be patient, and we'll be with you soon. In the meantime, there's some really great music for you to listen to that will follow this message. Thank you, and your doctor will be with you soon.
So the benefit to me of having that recording is that if the patients have to wait, at least they know they're going to wait. They've got some music to listen to. The message takes a while. And I've had a couple of patients that had to wait a very long time. Yesterday morning, I was stuck in another consultation for a while, but they knew they had to wait. So now that's what the patient's finished. They're now sitting waiting. What you will see on your computer is this. You will see there's Jeff Practice is the patient. He's been waiting for 2 minutes, and you now can invite him into your consultation room when you're ready. If you know you're going to be a long time, and I use this all the time, you can send a message. It says notify there, so you click on notify. You can type in, hi Jeff, I'll call you soon. And then you send that, and that'll flash up on his phone or on his computer. So he knows you're still there. He's aware that you know he's going to stay there. When you're ready, you click on join call, and Jeff will come in to the waiting room and into your appointment room, and the consultation starts then. So that's that. Coming into the consultation. So I'll just quickly, briefly again, my staff note tells them it's a telehealth. They're going to get an email or a text. They know, they explain, they've got to follow the prompts. Quickly, I'd like to share with you just how my desk is set up. It's very important to have good eye contact, especially if you're doing a lot of counseling. I do a lot of counseling through Zoom. I do a lot of methadone, so box-zone work. A lot of it's done through Health Direct. It works amazingly for methadone patients. I can see them. They're at home. They never miss their appointments, because I can find them. Even I had one patient who was walking a horse through the fields, and I sent her a message, and she logged in, and we had the consultation while she was walking a horse around. So your patients, so basically you need good eye contact. So you need, like for example, now you can see I'm getting good eye contact with you, and because I'm looking at the camera. So the way I've set this up is I've actually got my camera's on a stand that sits in front of my computer screen and I can move away to the side quite easily. There's my friend Russell, who's posing as a patient. And what I've set up is like that. There's my screen. On the left-hand side, my patient. In front of the patient's face is my camera. So when I'm looking at the patient and I'm doing a consultation, the patient feels that I'm looking intently directly at them. And on the right-hand side is the patient's notes. That's just a photograph from the side. You can see how my camera sits, and it's easy. I just pull my camera out of the way, or I can just lie it down. So the benefits of Health Direct, there are many benefits, but the main one to me is it mimics exactly what's happening in reality. I've got my virtual waiting room in Health Direct, and I've got my real waiting room out in the waiting room by the front desk. And I know who's who, I know who I'm going to call in. They listen to music, they know when they come in. It actually mimics the normal flow exactly. Inviting patients in with a text message or with an SMS, like I said, email, they know. It's very, very rare that a patient, I'd say one patient a week doesn't come in and use the system properly. So finally, I'd like to share one more thing, and that's my screen, all right? So in terms of the screen, if you look at your keyboard, you'll see there's a window icon on the left hand, in the left side where that arrow on the photograph is, and the right hand side there's a left and right arrow. So if you hold down that Windows icon and hit the left arrow, everything on your screen will move to the left. So for example, that's my screen. If I hold down my window and my left arrow, it all shifts to the left. This is my patient's notes. If I hold down my window and my right arrow, it all shifts to the right. When I put them together, that's what my screen looks like. My patient's in front of me, I can see myself. On the right-hand side, their notes, I can do everything I need electronically, and it makes for a beautiful, easy virtual consultation. Thank you very much. Sally?
Sorry.
You there?
So much. Thank you so much for that, Dr. Zorman. That was excellent.
Thank you.
So I'm just going to, there is a lot of questions, so I'm just going to start asking questions and I'll direct them. So here we go. What are the biggest challenges providers experience? I'm not sure who would be best to answer that one.
Say that again, Sally, the question.
What are the biggest challenges providers experience?
Can I answer that perhaps?
Mm-hmm.
So the biggest challenge is to me is patient reluctance and doctor reluctance. Okay, the two reluctance, and it's I don't quite understand it because I love it and it's so easy. So I've had a little reluctance with a number of practitioners, and then I think it's just practice. So if you're a practice administrator or practice manager, my advice is be enthusiastic, maybe sit with your doctors and run through a couple of trials with them, with you holding the phone, with them doing it. So I think the reluctance is just maybe the fear of the unknown, but just practice with them. That's the first thing. As far as patients, I had a patient who would not do it. He lives out on the foot of Mount Buller, and there's no way he was going to do this. And he drove from there for a consultation last week to see me. And in my waiting room, I said, take out your phone. And I sent him the text message. He took out this cracked old iPhone and he did it by himself until he could see he was logged in on my screen. So patient reluctance also, but I think what I've been doing is I'm actually encouraging, maybe even forcing a little bit, our patients to try. And I've only got one patient who can't do it, and because she's got one of those old phones that don't work, it doesn't work as a smartphone. So it's patient reluctance, practitioner reluctance, and I think it's a matter of just being more encouraging, and it'll happen.
You probably answered the next question. It's what is your experience using this platform with elderly patients? So you've probably already said that.
Can I answer that, Sally, as well? Sorry. Yes. I find my 70 to 85-year-old cohort far more effective than logging into Health Direct than my 20 to 30-year-olds. My 20 to 30-year-olds, they struggle, they don't quite get it, they get lost, whatever. But my 60, 70, 80-year-olds, no problem.
Should be the other way around, but that's okay.
It's weird.
Judy or Jody, I'll ask you this one. How does this work with confidentiality, like psychology sessions?
Yeah, so we do have a lot of psychologists using our platform. In terms of confidentiality, I'm just wondering if they mean because you can see people coming into the waiting area. Is that the question? Because
yeah, it just says, how does this work with confidential sessions? I presume, yeah, for a psychologist, a psychiatrist, that's all it actually says.
So as mentioned before, so the actual session itself is confidential and none of the information is available to anybody else who's not in the call, and then that's purged at the end. So there's that side of confidentiality. And also, all people can see in the waiting area. So if you've got various psychologists in a practice, say, they can see the patient names coming up as they're coming into the waiting area. So if that's a concern, a couple of our psychologists have been set up so that they're the only service provider in their particular clinic. So that's where Jodie and I can work with people to set up the workflow for them so it is going to work.
Dr. Zorman, can you please discuss aspects of physical examination?
Yeah, absolutely. I've examined tonsils. I've diagnosed infectious mononucleosis. I've obviously a rash is easy. When patients come in and they've got terrible back pain, they can't get out of bed, and I say, "Where's the pain?" and they point to the trochanteric bursa, so you know it's trochanteric bursitis rather than back pain. I mean, it's you're doing a consultation. The only thing you're not doing is checking them for rebound tenderness for appendicitis. But I mean, it's clear, and you see things, and in terms of examinations. Every day I'm doing proper visual examinations, and it's very effective.
How will this, will this be in line with privacy and confidentiality of patient, considering that it is digital, not face-to-face? Again, the privacy and confidentiality.
Yeah, absolutely. Every session we use by Australian standards for privacy, for patient information. We also, the way that our system's set up, we won't go too tech into it, but each consultation is completely private. We don't store any information. Nobody has access to it. The call information is purged, but not recorded in the first place. There is also a call lock option if you wanted that added layer of security. And then you can also put up a privacy consent, you know, in the first place, just to let the patients know what it is that the consultation is going to be, assure them that there is going to be no personal information or any record of the consultation kept. But yeah, absolutely. That's why, you know, that's our bottom line, is the security and privacy for clinicians and patients.
Yeah, and I realise just for time constraints, I didn't go into that in too much detail in this particular forum, but we can do that in other kind of training sessions and sessions that we set up as well, just to let you know.
Sally, can I answer a question that popped up earlier that was a very good question? Mm-hmm. So there was a question that popped up earlier, was, is the link the same for every patient, every session? You know, and I think it was an excellent question, because your link is exactly the same all the time. Your clinic link is the same. All the doctors in your clinic will have the same link. And the beauty of that is that the patients can keep the link. And a number of my patients, not all of them, but a number of patients who want the ability to log in anytime, I've said, look, if you want to see me, you can just log in. Because what they're doing in essence is they're walking into my waiting room. They're not coming into the consultation room. So there's about 5 patients I've got that I've said, that link never changes, use it whenever you want it, and I see the name pop up. If I can't talk to them, I say, hey, John, can't talk to you now, can you log in 2 hours' time? But one particular patient whose brother goes to the house all the time to check on her, I've said, if ever you're at the house and you want to see me urgently, just log in, I'll see you in the waiting room, and if I can, I'll let you in. So the link remains the same for every doctor in your clinic all the time. It never changes.
Yeah, and just on that, some people ask about if it's the same link, what if they just come in, like you're saying there. So with Dr. Zorman, if you are happy for people to come in, and if you can see them, you can join them, that's fine. Or you can just say, look, at the time of your appointment or 5 minutes before, come in. If they come in outside of that time, they can't see anything. They can't see the waiting area. All they can see is their screen. which is their waiting screen, and they're getting messages sent and things like that. So there's no actual security issue there. And if nobody joins them, then they're going to be just sitting because they haven't got an appointment. It's just like if they walk in off the street and say, oh, I was just walking past, I know I haven't got an appointment, but my finger's sore or something. If somebody can see them, they will. Otherwise, they might just say, sorry, we'll have to make you an appointment. So in some cases, sometimes reception staff can also answer those calls and say, oh, Jude, I noticed you've come in to the waiting area. You don't have an appointment. Would you like to make one? You know, so you can manage it exactly the same way you would as if somebody walked straight in off the street. So in terms of them just sitting in the waiting area, maybe they will just sit there. If they come in, if you're open until midnight and they come in at 11 o'clock, no one's going to join them. The worst thing that will happen is they'll probably just get bored and log back out because your clinic, if it's open, they can get in, but it's very unusual for people to just go in to your clinic at the incorrect time.
But you'll know they're there because their name will be in the list.
That's right.
Just as if they're in your normal waiting room. It's a virtual copy of what's happening out there.
Yes. I just saw one, sorry, Sally, that last one there about the booking appointment. So what I had to really gloss over was the clinic link, and Dr. Zorman did talk about getting that clinic link and incorporating it into templates in your practice management software. But you can send it straight from the platform as I did, or you can copy the link and do it in advance. You can do it however in advance you currently do. All you're doing is including the link. So it doesn't change the way you do bookings and manage those bookings and send out reminders. You just include the link in those and then it's the same. Reliable internet. Mm-hmm.
Thanks, Stephanie. Yeah, I've got NBN, and I haven't had problems with my internet connection, thank goodness, so far.
Just to let you know, I didn't show this either because of time constraints, but you can actually change the video quality when you're in a call. So you can put it down to low quality, which makes the streaming size of the video, if you've got someone in a remote location, for example, and the quality of the bandwidth size between you is low, you can actually change that in a call. So it is configurable to a certain extent, and that enables it. Certainly, if you put it on bandwidth restricted, for example, the video may not look as good, but the audio you will be able to still hear because that's a much smaller amount of data that takes up.
So while you're here, Jude or Jody, is there a breakdown of numbers of telehealth consultations related to where the patients live? For example, Melbourne versus Perth, where lots of lockdown versus minimal lockdown.
Well, I mean, kind of, definitely. It's really tricky because we look at things in PHN regions, and PHNs are all different sizes and they do different things. So for one example, New South Wales North Coast have a lot of mental health and other therapy practitioners, and they haven't had very many COVID lockdowns, but they do a huge amount of telehealth in that region because of the allied health practitioners that they do. But generally you would see that Victorian clinics do a lot more because they've had more lockdowns. What we find is once somebody starts doing telehealth because of a lockdown, probably, they continue to do it even when the lockdown has eased. You'll see a little bit of a drop in the numbers. So yeah, definitely. Then we will see Northern Territory, Northern Queensland, places like that do very little because probably that's COVID related. But yeah, so yes and no. It really depends on the clinician appetite for video, really. But overall, if you looked across the country, it does seem to start with a lockdown. And Victoria definitely does more. And now the Sydney GPs are doing the bulk of telehealth.
And that's definitely the case in the primary care, and yeah. Victoria does a lot of stuff in the tertiary care because they've been well established for a long time. So in the tertiary world, it's a little bit different, and that maintains through lockdown or no lockdown. So just
yeah,
to
in the hospital
let you know.
systems and stuff, it's not related to lockdown at all. It's just the business as usual includes video now. Yeah.
There are more questions, but we are out of time. It is 1 o'clock. So I'm so sorry we can't get to all the questions, but it's been a brilliant session, and I hope you all got a lot out of it with everybody. Health Direct, Jody and Jude are certainly there. They can help you with any questions or to set up or any assistance you may need. So I would like to thank everybody. So Dr. Zolman, Jody and Jude for
Thank you.
presenting today. It was really brilliant, and I really do hope a lot of people got a lot out of it, because there was a lot of information in there, and good information. And it just goes to show you how easy it is to use Health Direct and how to use the video consultations. So it really is. So thank you again. There will be a short survey, if you wouldn't mind just filling it out for me, and a recording, and both the presentations will be emailed out to everybody in the next couple of days. So again, thank you so much.
Thank you.
Yeah, it was great. So can't thank you all enough. So thank you all for attending. Enjoy the rest of your day.
Thank you.
Thanks,
you.
everyone.
Thank you, everybody.
All right.
Thank you. Bye.